Bonjour, everybody. Chief Jason Henry here. Just touching base, community update about the coronavirus COVID-19. At present, there are no confirmed cases in the community. There are no confirmed cases in our county. We're currently have many community members that have chosen for self-preservation measures to self-isolate. But that does not mean that they have the virus. It just means that they are taking precautionary measures to protect themselves and their family. This is new for us. We've never had an actual global pandemic before in this First Nation, although we do have a long-standing community pandemic plan. And in that plan, we have a community control group, which has been meeting regularly to discuss the plan going forward. There is a plan. We've currently implemented many parts of that plan, which include communications and community closures. We've taken those steps. We're working on sourcing some resources to help community members that are in isolation, looking for food supplies, and making sure anything we need is on hand for our community. As Anishinaabe people, we've survived many worse things than this, and we've persevered through that. We are hunters, we are fishers, we are gatherers, and we still have natural medicines. As example, cedar tea is something that I know most community members use in the cold and flu season, and we look to those types of things to, assure ourselves. We're not currently in a state of emergency, although that is not out of the question for happening. I mean, anything is possible right now. Social distancing is one of the main precautionary measures, and hand washing. And as Indigenous people, we already practice quite good social distancing. We're not overpopulated here. We're not overcrowded here. We are in rural Ontario. One of the biggest concerns right now, I think, is people's access to food and toilet paper. There are many ways that you can get around that, the toilet paper issue. For food, we are looking to find some help in that manner. One thing that I need to alert the community to is the fact that the North Lambton Community Health Center, Kettle Point site, and Watford sites have closed due to a staffing shortage presently. They may reopen in the near future. If you have any of the signs of COVID-19 and wish to report to a medical facility, the North Lambton Community Health Center and Lambton County Public Health Departments are asking that you call in first. Give them your signs and symptoms before reporting to their sites. We do not want to overwhelm the public health sites with unnecessary visits. So please, again, if you feel you have the signs or symptoms of COVID-19, call first and then follow the advice of the medical professionals. As a closing comment, I want to ask community to remain calm. When we panic, when we get upset, when fear sets in, our mind changes to fight or flight mode. And in that type of mode, we don't think rationally, and we do irrational things like buy thousands of rolls of toilet paper. The more calm we can stay, the more planning we can do rather than reacting, the better off our community will be. Look forward to ongoing updates as this evolves, and we are in close contact with our federal and provincial partners as to the evolving situation. So we thank you for your attention today and look forward to upcoming updates.